Hello and welcome. This is Bhragu Haritas from ET CIO, and we have with us Mr. Sumit Puri, who is the CIO of Max Healthcare. Welcome on the show, sir.
Thank you.
So, what are the recent digital initiatives undertaken by Max Healthcare to enhance customer experience?
Well, we've taken quite a few initiatives. Very clearly, they're partly linked to patient safety and partly linked to customer experience. In some ways, the objective here is to make sure that we have safety with convenience, meshed together. So, on patient safety initiatives like electronic health record, we are one of the first private hospitals in India that embarked on the journey of electronic health record, which helps us have a complete repository of patient health information. That basically is now going to become mobile. So we're making it mobile electronic health records available to our doctors and to our patients, which would be hugely beneficial from a space safety standpoint. We're also looking at e-prescriptions. We moved significantly from where we started on e-prescription to almost 85% in major hospitals, which again will give us very good indication of what are the treatment that have worked well for patients and will help in the trend analysis and analytics to further enhance patient safety. This is primarily the focus that we actually have on safety, with clinical parameters being looked at, clinical dashboards being created, in which you can continue to improve on certain aspects and further enhance safety for patients. From a customer experience standpoint, a lot of new things that have been done, innovations like we've actually tried to look at a self-service portal, which allows patients to get all their records at one place. This could be any hospital, not just Max. They could also link their family members to it. They get discounts through booking on the self-service portal. They can actually get emergency calls made. They can schedule appointments. They can try and also look at Max at home services, which they can invoke from there. So hugely beneficial. And our goal really is to reach out to our customers rather than them having to reach out to us.
Which new revenue streams are you opening at Max Healthcare with technology?
I think some very interesting experiments being done. So frankly, what we are looking at is new strategic business units. We've actually opened, like I mentioned, Max at Home platform, which is about home care, because the future is in prevention. It is not only about curative treatment, it is also about prevention. So that's something which is going very well. We've had significant success over the last year and a half, since we've launched the digital platform. We've done Max Labs as another B2B operation for outsourcing lab operations of other smaller hospitals or nursing homes to Max Healthcare. That's again a very interesting initiative that is happening, which is doing very well. We now have almost 15 HLMs, so hospitals that have outsourced their lab operations to us, and about 550 collection centers. Similarly, we are looking at new areas like telemedicine. We are looking at aspects like daycare, oncology daycare, reaching out to our patients and making sure that it could be very convenient, for them to complete the surgery within daycare and go back. Remote OPDs, being explored. So these are initiatives that are going to really help us in terms of not just reducing the cost, but also, I would say, actually enhance experience, for our patients and generate revenue for the organization.
As artificial intelligence is disrupting every industry, and the healthcare sector too hasn't shied from it, so what are the specific use cases that you are implementing artificial intelligence at Max Healthcare?
Frankly, I just mentioned cost efficiency and productivity. I think artificial intelligence would play a huge part, in helping us in this journey. Use cases that we are trying out here right now is on diagnostics. So what could we do to start, using AI to look at X-rays, CT scans, brain volumetric analysis in those reports, and use the combined power of AI and of machine learning to decipher whether this X-ray or CT scan or volumetric analysis is fine from a safety standpoint, or does it require further investigation? Does the doctor need to look at it further? So frankly, the accuracy rate of AI on diagnostics is actually now much higher than what, let's say, an average radiologist can actually look at. And we do see AI in some ways standing for augmented intelligence. I mean, I kind of call it augmented intelligence because I'll not probably say that it is going to replace doctors or replace radiologists, but it's going to really help them, in terms of delivering better results, for our patients. So what we are kind of trying to do is using many of these AI tools to, improve productivity of a radiologist. The basic work, the basic analysis is done by the AI engine. It gives you the results, and then senior radiologists can just validate the results and confirm. So the time taken is significantly reduced in terms of the AI results, and we are able to look at a much bigger volume of cases, which is hugely required for a country like India, where we have a big geographical dispersion. We do not have trained radiologists, etc., in various parts of the country. So we could do teleradiology. We could actually kind of take all these cases from various parts of India, and also in fact international locations, and get them done through a centralized team from let's say Max Healthcare, or some of the other hospitals there. So to me, that's a very interesting experiment we are doing, and some very good success results that have come in the last few months. The other area that we're kind of looking at is looking at predicting let's say risk of readmission for heart patients. Now this is again a very interesting experiment which we did. We spent almost 18 months with research institutes like Deakin University, Australia, to fine-tune algorithms which will help us predict the risk of readmission for heart patients. We all know the risk that this could carry, and if we have these parameters available and we can use these in time, I can save lots of lives. So that's again something which is working very well in the last almost 10 to 12 months, and we've seen some good initial results around this, which I think will be the way for the future. So to me, I look at AI as a boon for understanding what treatment protocols have worked well. It will help us improve productivity. With mechanical tasks, it will basically automate those mechanical tasks and make the job of healthcare providers simpler. At the same time, at some point of time, we'll also probably look at aspects like the primary and secondary care analysis, the triaging, the diagnosis. You will again be able to augment the doctor by giving them some indications of what the diagnosis could be. So today 75% of our patients who come are coming for primary care problems, and fever, cold, some such things. If you have first level analysis diagnosis done by AI, it will make the job of the doctor much simpler. A super specialist does not have to spend all his time in asking for basic symptoms. You could have the AI tool giving you some predictions, and that will help him in making the final decision. So today, these are all areas that will be extremely beneficial for a country like India, and we can definitely use this to further enhance our understanding and then democratize this across the country. Probably have a lot more of those super specialist information available as a knowledge kind of base for other doctors and clinicians to benefit from, because you will further add to the intelligence when I have some more information added to the repository. So that to me, that those are interesting areas which would be very beneficial as we go forward, and the signs look very promising as I see it today.
Well, those were some really valuable insights, and thanks for giving your time to ET CIO.
Thank you so much.